And she is also one of the person who is very instrumental in making my father take the supplement. So let's put our hands to welcome Dr. Nelly Chong.
Everybody, please promise you will not throw your shoes at me. I know everybody here hates doctors.
So this is Dr. Nelly Chong, and as you can tell by the surname, she's related to me. She's my sister. Younger or older, you decide. But yeah. But actually, so we form a good combination after she taught me something about healthcare and sick care. So would you like to tell us a little bit about yourself, your history as a GP?
Hello everyone, I'm Dr. Chong. We all have to promise, I know everybody in Avita hates me. I was actually going to go out just now. Because nobody trusts a GP, nobody likes a doctor, then how? So luckily, I retired. So it's okay, you can continue to hate. Anyway, I've been a GP, a family physician for 35 years. And in my work, I see patients from very young to very old. So I have many, many generations of patients. And somewhere along the line, as I grew older, they grow older together with me. Then I realized that how come my patients are getting chronic illnesses very early? I have patients at 40 years old with heart attack, with diabetes, with cancers and everything. So I feel that at one point in my life, maybe I was growing older also, I felt that I was not in healthcare. I was actually in sick care. Because no one will see a doctor unless they are sick, right? So, and no one believes in taking care of themselves when they are not sick. So at one time in my life, I'll tell people when they ask me, what do you do? Oh, I'm in healthcare. Then when the time I reached 55, I was like, I'm actually in sick care. So yeah, so that's how I started.
So how do you come across Celergen?
Somebody gave me some Celergen. I look at it and I'm like, what's this? Right? I've got better supplements, cheaper supplements, and I can afford most of the supplements that I give to my patients. Right? So I didn't believe it, of course lah. Why would I believe it, right? I'm a doctor ma. So I tried because at one point in my time, a lot of things were happening. My husband had a heart attack at the age of 50, had to go for bypass. My father was sick, grandmother was sick, father-in-law was sick. And then that person came and told me, you know, if you fall sick, the whole family also sick, you know. There's no one to look after us. So you better make sure you take care of yourself. So I started taking because it's very expensive. And then I felt that I was more energetic. I slept better because I have less stress. I just slept. And a lot of my patients started noticing that I was looking much better. They were all betting that I went for Botox lah, facelift lah, all kinds of things. And everybody wanted to know what I was taking. So I thought, okay lah, maybe got something in it that I don't know, yeah? So started learning about it. And then the first guinea pig, my father. Because I was tired of looking after him. He was costing me a lot of money. So every month I buy him the medicines at cost. It's still more expensive than one box of Celergen. Yeah, so from about 10 to 15 types of medicine, we cut until he was just taking Celergen and NGF. So I felt that, and because now he's so capable, I don't have to look after him. So he go and travel himself. I can do my own things, right? So I felt like, okay lah, it's money well spent. And now he's earning his own Celergen, so it's even better for me.
You want to share something about what happened with your father-in-law? Your late father-in-law, you were rushing him to hospital.
Yeah, my father-in-law passed away at the age of 94. And he used to live in Farrer Road. my clinic was in Clementi. So in between my clinic sessions, I'll be running back and forth because the maid will call me and say, Mama, Gong Gong now breathless, because he had heart failure. So I was rushing back and forth, and every month he'll be in hospital at least 2 weeks. And then the doctors won't do, there isn't very much to do for him because at 90 something, right, every medicine you give will have a side effect. So you are always balancing, this one take, this one cannot take, this one. So finally I told my sister-in-law, okay, let's stop it. Let's try. Because it worked for my dad, maybe it will work for your dad. So we started him on Celergen for his heart failure. And he got very much better. So towards the last 3 years of his life before he passed on, he never had to go to the hospital. Of course, I also learned the meridian therapy, put the oils and all that, and his heart failure got much better. The maids were taught how to massage him, treat his lungs, so he stopped using inhalers, he stopped using nose sprays, and he passed on very, very happily at home with all of us around. And it brought us a lot of time because we were spending quality time with him at home rather than in the hospital where he was being put on all kinds of drips and things like that. So I think in that instance, it really helped him. Whether I believe what is in Celergen or not, it truly showed up in how I manage my patients.
So do you help your patients with Celergen sometimes?
Mike.
Yes, by the way, Mike.
Mike is my patient. I used to scold him when he told me that he was going for the Ironman. My first thing with Piggly was, please don't die. And then he's gone to another one now. Yeah, but the thing that impressed me most at first was my very first patient who started Celergen was actually someone who couldn't sleep. He had very bad insomnia. And we all label him as a drug addict because he goes to every different clinic, takes sleeping pills, take cough medicine. And I used to scold him because very young chap and taking all these medicines. So just out of spite, one day I told him, I tell you what, I'm taking something that helps me to sleep very well. Would you like to try? Because I think he cannot afford, Then he said, how much? I said, it's about $12. Then he was like, $12 a tablet? If I can sleep one night without any medicine, $120 also I pay. So I said, very good, 1 box of Celergen. And after that, I never saw him. After that box of Celergen, I never saw him ever again in the clinic. And the next thing I know was I met him at Avita office. And he's happily back at work without being labeled a drug addict by all the doctors and didn't have to be dependent on sleeping pills. So for that, I was like, wow. Yeah, so that's my most memorable patient, my very first patient, number 1. The other patient that somebody I just saw recently was Indian patient who has rheumatoid arthritis. For a man to get rheumatoid arthritis is already quite rare, but his was really bad. So his fingers were really bad. He couldn't even open the door. He couldn't write. And all he wanted was either steroids or painkillers. So, of course, I'll fight with him because I don't like to give steroids and I don't like to give painkillers. So we had a big fight in the clinic. He said, I know what I'm doing. The doctors always give me, I'm seeing all the specialists and all that. And I said, good, go there. Don't come to me. I do not give such things. So we had a big discussion. Finally, I say, want to try this or not? Because it's something that helps in inflammation and it helps to build up your immunity. So he was desperate because I won't give him the medicine. Then he said, okay, I'll try. After 10 days, he told me, guess what? My joints are much better. I'm off all painkillers. This is about 8 to 9 months already. He's not taking any painkillers at all. And of course, he's not asking for steroids. So he lives quite near the clinic where I'm working at now. And he just, every time he runs into me or with his friends, he'll say, this is a doctor that saved my life. So y'all don't hate me so much, okay? Please.
We love you.
All right, thank you very much. So I know this doctor refused to give painkiller, and that's how I got to know Celergen as well, because I was in pain for 1.5 years after my 6th knee operation, and she refused to give me painkiller or steroids. That was when I went to Alvin, and Alvin introduced
a better
Celergen to
doctor.
me. All right, thank you.